You know, what we're learning is that traumatic brain injury, I mean, it's really burst into public attention over the last little while, especially with the increasing prevalence in the military due to exposures to IED, blast type injuries. Also NFL, of course, it's in the news for that. I'm specifically focused on the symptom of photophobia. And so, you know, there are some patients with traumatic brain injury, and some of those that you know, are later found to have developed CTE that may not have photophobia. But what really got me interested in this was you have patients that come to the clinic, and these are patients that have had MRIs done, and there's no evidence of a brain injury. And you do a regular eye exam, and they see 20/20. Their retinas, the back of their eye looks great. Everything from a standard eye exam is within normal limits, and yet they're telling you as the clinician that this light sensitivity is debilitating, that it's affecting their quality of life, that they can't go out to the store because they get these massive headaches due to the indoor lighting. So that really sort of drove my interest in why we started looking into this, because you know, here are these patients saying everything on standard tests is coming up normal, yet I know my eyes aren't normal. What's wrong with them? You know, first with the study, what we found is that when we challenged them with a light stimulus, it was a 2-minute long light stimulus that alternated between red and blue light. And first of all, if we just did a brief pulse, 5 seconds after we had put the patient in the dark for a while, we didn't see any difference in the response. But if we repeatedly challenged them over the 2 minutes, so a series of 5-second pulses on and off, 5 seconds on, 5 seconds off, by the end of the 2 minutes, their pupils were more constricted, significantly more constricted than the controls. In other words, with that 2-minute long light challenge, with their pupil being more constricted, it's like the signal is suggesting that it was you know, increased in terms of the response that's going back to the brain, and then subsequently driving the pupil closure. So what we think is happening is that essentially they can't adapt to that repeated light stimuli. You know, if you think about you know, even yourself, when you go in the dark and then you get, for instance, in your darkened theater, and then you go outside, you have that bright light, you get that sense of photophobia. So when we dark adapted and just did one flash, there was no difference. But it's that repeated light, so the way I like to think of it is, whereas when we go outside, yes, there's that brief sort of sense of photophobia, but then we're able to adapt to the light. And it seems like in their case, there's a reduced ability to do that, so that we were uncovering with the test. Now you asked about treatment. We didn't assess treatment as part of the scientific part of the study, but what we did is we offered any subject who took part in the study, they could either get a money reimbursement or they could get a pair of prescription orange tinted glasses. So the orange tint blocks out the blue light that's in these sort of white light sources, and there's been some anecdotal evidence in the clinic that's been beneficial. So 71%, way higher than I was expecting, 71% chose the glasses over the monetary reimbursement. And most of them, even a few months later, still were wearing the glasses and said that it made a huge difference in terms of how they were now able to function under light, you know. And so we really don't know why, and we don't know for sure if it's a placebo effect. That wasn't what the study was getting after, but it is something that we're kind of interested in. So we were able to put their prescription into the glasses, so they would just wear these instead of normal glasses. So, you know, if they still had their other glasses, so the advantage of these, say, over dark sunglasses is that if you're indoors, for instance here, sometimes it's hard to read a book with the dark sunglasses, whereas these orange tinted glasses, there was enough light going in that they were able to see it, and yet it seemed to cut down on this sort of sense of photosensitivity and the headaches that they would sometimes get. Well, we would like to, in two different approaches on this type of topic. One, we would like to learn a little bit more about the types of altered light adaptation that happens, and so being able to refine this pupil test as a diagnostic test for photosensitivity. So challenging them with different levels of light. So for instance, dim light, medium, bright light, and then measuring their pupil response after that and seeing how much it changes. I also would love to do a study that actually looked at whether or not these glasses are changing retinal function if they wear it over a long time, or and try to figure out really why these glasses work. It's a very difficult study to do because the patients obviously can tell that they're colored orange, so it's hard to keep the patient masked to the fact that they're wearing these glasses. So it's a tricky question, but one we're like to try to figure out.